All right. Welcome, Carrie, to the Solid in the Saddle podcast. We're so glad that you were able to come on, and thank you for joining us this morning.
Well, great. Thank you for having me, and I'm looking forward to visiting with you today.
Awesome. So, I would like you to just kind of begin with introducing yourself. Tell us about your background in horses, and just give the audience a little bit of an introduction to yourself.
Okay, great. So I'm born and raised in Montana. Grew up in central Montana, and my family ranched. We ran cows and farmed in central Montana, but then also my folks outfitted. So my dad was one of the very first licensed concessionaires in Yellowstone National Park, and so my summers were spent with a string of mules on the backcountry of Yellowstone National Park and the greater Yellowstone area. We ran probably about a oh gosh, 100 heads of horses and mules between the outfitting. And then when my folks started in the, what was it, 88, I guess, is when they built the guest ranch. We had a guest ranch in the upper Madison and was capacity of 30 guests. And then I think there was about 15 crew. And so we did all the horseback riding as well as, of course, fishing. But at that point, like, yeah, around 100 head of horses and mules.
Oh my gosh.
And then about the time I got in high school, my family both has background with racehorses, both my parents, and they kind of got away from it. And I, was rodeoing in high school, junior rodeoing and high school rodeoing. And my folks went down to Oklahoma to the Heritage Place sale one year and came back with a bunch of horses. And they decided there was one colt, we call him LFR Johnny Reb. He's still in the place. He'll be 30 in February, but they were going to sell him as a yearling and dad decided, no, let's run him. And as the saying goes, the rest is history. Because that little horse got the bug back in him. He won 10 races, I think, between 200 yards, 870 yards, and started the craze. And that was like, I guess, when that horse was born in 95. And so from then my folks really got back into the horse racing side of things. And we're doing all that in the ranching outfitting. And when I was, ever since I was a little girl, just growing up, veterinarians played such an important role. And I have such fond memories, even in Stanford, of old Doc Nordell and Doc G coming over, working on something. And I always knew I wanted to be a veterinarian. So I pursued that, went to undergrad at the University of Idaho, and they had a 3+1 program. So if you got all your prerequisite done in 3 years and you got into vet school, your first year vet school would transfer back for your BS degree. So, and when I was at University of Idaho, the other challenge was in Montana, there was no WICHE funding, which allows in-state tuition at Washington and Colorado. So I kind of had to apply at large. And I was fortunate enough, I got into vet school at Louisiana State down in Baton Rouge. And that was a culture shock for this little rural Montana girl going down to
Mhm.
the bayou and learning that winter, even though we get annoyed with it, is good because it kills things that we don't have up here. Like I had never heard of horses not being able to sweat or all these weird fungal diseases, right?
Yeah.
And so I went to vet school in Louisiana and had a blast, learned a lot of great things down there. And then upon graduating, actually practiced in Alaska for quite a few years before coming back to Montana. And then after about it was about 10 years of general practice, I kind of got a little disheartened with like general practice and knowing I didn't want to own a practice, but I knew there had to be something a little better, especially for our equine athletes as far as like prevention. So I started to pursue kind of, it's integrative. At that point, it was kind of considered alternative, but it's really an integrative medicine, looking at acupuncture and chiropractic and really looking at trying to prevent things, right? Not trying to say, okay, great, now we have a problem. Let's just stick a steroid in a joint and keep going. Like, why did that horse need that?
Mhm.
And so I started to do that. And one of my favorite quotes is by a veterinarian out of France, French veterinarian by the name of Jean-Marie Denois. And I like this is the heart and soul of what I believe is that, horses rarely one bad step rarely equals lameness. It happens. Usually, lameness is because of 10,000 not so good ones, right? And so, how can we keep our athletes moving effectively and appropriately so we can minimize that wear and tear on their body? And so that's when I've kind of pursued that. And that's all I do now, really, is just the acupuncture chiropractic work. And still, my folks still run some race horses. And so that's
Yeah.
kind of where
Oh my gosh. Thank you so much for that background. I did not know all of that. And I think that That's so cool that you had a really great foundational background practicing for 10 years, and then you kind of were able to niche down into the thing that you're most passionate about, which now you get to bring to southwestern Montana, and we're so lucky to have you. So we're going to get into that a little bit. Actually, why don't you just tell us about the Chi University and how you help the horses through acupuncture and chiropractic work?
Okay. Well, when I decided to pursue acupuncture, as there's only two places in the country in the United States that as a veterinarian you can go get certified in acupuncture, and one's at Colorado State and one's down at Chi University, which is associated with the University of Florida's vet school program. And, and I'm not going to pick on Colorado State here. I don't mean to have this sound this way, but at CSU, they try to make it very scientific. Like, this is what this is this. And yes, there is a lot of science behind acupuncture, how it works. I mean, even on the human health side, the Institute of Medicine, has come out, back in the 90s with things that we know acupuncture is effective for. And there's more and more literature showing, the effectiveness of it for a lot of issues across human and animal health, but there still is an art to it. And at the Chi University, Dr. Husheng She, he is like a fourth generation acupuncturist from China. He's a US citizen now, but you know, that is where it came from, right? Is China. And it's also being taught by somebody who is this generational acupuncturist and herbalist. I thought was extremely important.
Mhm.
Yes, there's all the science. They definitely present all the science, and they're doing amazing work on looking at different points and the science and all of that. But there is that art piece that you can learn with that Eastern side. And
Mhm.
so that's where I started the acupuncture. And I got certified a long time ago, but then I decided, wow, they offer a master's in traditional Chinese veterinary medicine. And so I've completed all the courses but my thesis, which I'll start on this spring which is your research project. So I'll
Oh,
be
okay.
working on that. And I think I know what I'm going to work on, but I haven't quite got it all there. But I'll finish up so I actually have a master's in traditional Chinese veterinary medicine. And when I was down there, they also do a lot of integrative work and they do the chiropractic work, or really, and I should say this, as veterinarians, we technically can't use the word chiropractic. This goes back to human chiropractors and kind of a
Okay.
lawsuit that was, it's kind of all about the
Oh,
politics of
okay.
things. Even though that's what it is, on the veterinary side, we call it medical manipulation. And
Okay.
so I got certified in that as well. And they have a great program there with another wonderful veterinarian named Carla Pasteur, who I think is a great mentor. She practiced general practice for years, a lot of track practice, and she kind of that's all she does now. But it's great it's really focusing on the biomechanics of how the horse moves, how do the joints move, and when things aren't moving appropriately, what are the implications of that, right? And how does the axial skeleton affect the appendicular skeleton? And so it's just a great way. And it definitely changes in all the years of all the horses, lame horses I've looked at. What I learned during those courses definitely was something we don't really learn in vet school, like really looking a little bit deeper at
Mhm.
how that horse is moving and at certain especially their pelvis, their head, their neck. There's normal gait motions. And yeah, when we think of a lame horse, yeah, we get a head bob. And yeah, that's absolutely important. And a hip hike. But there's subtle things you can detect before it gets to that point if you take the time to really study that movement and how that horse is moving. And that's one thing that we really spent a lot of time on down there at Chi. And so it's just a great program. What I like about it, all the faculty there are all practitioners. They all, have had very, very successful traditional equine veterinary practices that that are doing this work more. And when you talk about Central Florida, it is the horse mecca of the world. When you're talking Ocala, Wellington, it's being around that caliber of horses and also those kind of professors, faculty is pretty amazing. They push you, and it's just a great program. And looking at it and using the science, because I think sometimes even in my field, my colleagues, sometimes when you say, oh, acupuncture, people are like, the voodoo, right? And it's like, oh no, it's anything but that. And so
Mhm.
that's the other thing is like, yeah, not only are we doing this, and this institution really is pushing how to do it, but it's also that research component and really doing those research studies that are proving the efficacy of it. And there's more and more every day that are coming out around that and just the importance of it and how well it integrates, right, with our Western medicine.
Mhm.
Because as the saying goes, you have a gunshot wound, you probably don't want an acupuncture needle, right? So you can't do away without the Western and the Eastern, but integrative for patients, that integrative practice is huge to keep our athletes healthy and sound and doing their jobs.
I could not agree more. I think, being on the horse end and the human end, that integrative approach is
Mhm.
really the best way to keep an animal or a human at top performance. So that brings me to my next point or my next question for you. Tell us your favorite recovery story of a horse where you used manual manipulation and acupuncture. What did that treatment look like? Maybe what was the diagnosis? And then what was the result that was able to come out of that?
This is probably one of my favorite stories ever, and this was a high performing barrel horse. Before the horse was diagnosed with EPM, and the horse got EPM, and as we know, even caught quickly, right? EPM and treated with appropriate Western medicine and having that appropriate diagnosis still cannot have the best outcomes for an athlete, right?
Mhm.
And this horse was diagnosed by a very, very good internist, put on the treatment, and the horse got about, I don't know, 80, 85%, but he still wasn't 100%. And this veterinarian put these clients in contact with me and were like, yeah, try it, right? Because Western medicine has kind of done what it can do for this horse. And this horse was competing at the PRCA level, competing at, college rodeo level. And I will never forget, I went out there to see this horse, this big, gorgeous horse, but he just, I'm a firm believer in looking at their eye. You look at the horse's eye, and that tells you all you need to know about that horse. The horse's eye was just wasn't a happy horse, just dull, just didn't feel well. And so we started acupuncture treatment, put him on some herbal therapies, and he still had some mild neurologic, remnants from the EPM, with things. And so we started on that. And he didn't care about the needles, whatever. He didn't even need anybody to hold him. Started working hard on him. But I also knew that this horse would be one of those horses when he got to feeling better, he was going to tell us because he was going to be a horse that didn't like needles, right? Like you knew that's where this was going with him. But I'm like,
Mhm.
when that day comes, it's going to be a great day. So we worked hard on him. It was like, I don't know, about couple 3 months, and he could start to really see the improvement. So then it was like, all right, let's go ahead and get him adjusted, make sure we can adjust him, make sure now that we're getting that neurologic function back where it needs to be, making sure we adjusted him so all his joints were moving appropriately, and then to start an exercise routine for this horse. Because the horse had some kind of SI issues before the EPM too, so just making sure we keep him going. And long of the short of this horse went on. The owner missed all the fall college rodeos senior year. And that horse went on that spring to win enough at those spring rodeos in order to qualify for the college national finals, ran fourth that year in the finals, went to our circuit finals, and qualified for the American semifinals. So to me, that is just one of the coolest stories ever. And I work on the horse still. We do acupuncture, but with a laser. He doesn't like needles, loves being adjusted, right? So it was so cool because at that point, it was, I think, the owners as well as the referring veterinarian was like, oh, I don't know, right? We got him as far as we can get him, with
Mhm.
the Western meds. And so to see him go on and compete at a high level it was just one of the coolest cases ever. So that's probably my favorite one. So, and
Yeah.
that one, and then like the other thing I love, these are not as big a high profile, but it's funny, being in Southwest Montana, right? All the ranching families. I work on a lot of ranch horses from, like my father was kind of the same way when I started all this, the crusty old cowboy, like whatever. Now it's like, right, I worked on all his racehorse. I work them all the time. But even some of these old ranchers that you never would think like want their horses adjusted and have things done to them. And now I see these group of ranch horses every year that we keep them going and performing. And it's fun, right? Because those horses work hard. And so I think those are success stories too, keeping those horses that work hard every day happy and
Mhm.
healthy and working for their owners, doing their job. So it's a lot of fun.
Mhm. It really shows how dynamic the treatment can be from anything from like a working horse that's pulling calves or roping bulls, that kind of thing, to the highest level of performance barrel horse that there is. And I love that story. That's actually how I found you, and we'll tell that story a little bit later because I want to talk a little bit about just the importance in keeping older horses sound. But What is the most unique thing that acupuncture can help horses with? So we've talked about the EPM recovery. We've talked about some ranch horse manipulation. What about something that surprised you that a horse that you were able to help a horse with?
Well, this is the funny part. I was used to do a lot of work at the race backside of the racetrack at Prairie Meadows. And what I loved about it, and these are the horses that I would love, and I have a couple crazy stories with some thoroughbreds. Where when I was trying to get clients, there's a scan you can do, and basically you're stimulating acupuncture points, and they're associated with certain body parts. And so whether it be a foot, a knee, an ankle, right, the hock, the hip, the stifle, and a lot of, and it's really accurate for areas that are bothering horses. And it's there was a thoroughbred little filly there, like a 3-year old, that they were going to turn out, and this trainer said, you know what, got nothing to lose, why don't you go through her, like, because a bunch of people had already gone through her. She'd had things x-rayed, she'd had things done. And I go in there and it's like, whoo, I hit the acupuncture points. I get a video of this for her hocks, and whoo, that mare was sore on the one side, like sore. So we went ahead and adjusted her, because if the pelvis isn't moving appropriately, there's all those nerves that come out for that hind leg can be get some inflammation and can cause some of those points to be a little reactive. So we adjusted her, did some acupuncture on her, and the mare, I said, give her 48 hours and go ahead and gallop her, see how she feels. And like, wow, this filly feels good. Maybe we won't turn her out for the year. And that filly went on to win a stakes race, right? And
Oh
so
my
so
gosh.
it's fun, because I love, what I really love is these horses that, and and this is nothing against any of my colleagues. Like, I love it when my colleagues have gone through a horse and can't figure out what it is. You've x-rayed, they blocked, right? It's like, we can't find out what's wrong with this horse, but the horse isn't performing. Because to me, that is where like acupuncture and the adjusting can really come in, because it can be those subtle things that we can't detect with an x-ray or an ultrasound, right? But they're enough that is bothering that horse. So I think that is one of the beauties of acupuncture and chiropractic. And I love it when those horses have had all that workout, because I don't have to worry now. I'm like, okay, you ruled out all those things that that are structural, that are bad, that we've ruled those out. So I love to go
Yeah.
ahead and work on those horses. And so I would see that a lot at the track. And that was the other fun part. You'd go in there and be like, well, this horse is this and that. They're like, you never even saw it walk. And like, yeah, that's what it is. So it's a lot of fun to be able to go work on those athletes and keep them going, and find those things out that we couldn't find with our traditional, Western medicine. So
Mhm. You changed the whole career trajectory for that horse. It with her being 3, that's amazing. So I want to tell the story of kind of how I met you and how you worked on Gracie so that we can talk about that because that was so amazing for me. Coming from sort of a Western background with horses to having you basically fix her. But um, it was in May of this year. I ran her at a barrel race. The first run, she made a great run. She placed fourth. And then the second day, she had a great run, but she kind of like had some trouble with the ground and then got really sore after. So that next day I pulled her from the race. I didn't run her. And then by the time I got her home, she was really, really lame in her hind right, like head bob, like couldn't really bring her leg forward. It was awful. And I thought she had torn something. I thought it was a career-ending injury before we even got started, really. And so I was entered in a rodeo that weekend with Haley Garrison, and I texted her and I'm like, Haley, Gracie can't even walk. I don't know if I'm not gonna be able to run with you. And she's like, well, Carrie's coming out to work on my horse. Why don't you see if she can work on yours too? So I brought her out to the Garrisons, and Gracie's still just lamer than lame. And you had me walk her in some figure eights, and it was just heartbreaking for me. Just walking her from the trailer to the barn, I was like, oh my gosh, this horse is so in so much pain. And you worked on her, and then you had me do some figure eights again, and it was like magic. Like she was just fixed. She had no pain in her hind leg. She could cross her back legs over each other. She could lift that leg forward. She had no pain at all. And then I went on to place in a pro rodeo that like the next day, or I guess it was 2 days later. So I ended up going with Haley, and then we ended up placing in a rodeo. And so I just want you to walk the audience through what happened. Like, why was she so lame? Talk about the thing that you did on her back where you ran your acupuncture uh tool down her back and down her leg and what it like flared up as, and then after you adjusted her, what that looked like.
Absolutely. So when I first look at a horse, a lot of times when most of us think of a traditional lameness exam, right, we think about flexing and trotting, right? And so I don't do that as much. I really look at them at a walk. And so what I have you do is when you're walking away from me when with the horse, I like to see how their pelvis is moving, right? So their pelvis should move side to side and up and down. And so I remember her right side was not moving at all. Like that right side was not moving. And then also when they're coming back to me, I like watching their head because a horse normally, their head should do a figure eight when they walk. And when you look at horses, if they have restriction in their neck, their head just goes up and down. So I look for that. And then also as they're going by on the side, I look for how much they're reaching up underneath themselves. And a lot of times you can see some differences. And I remember on Gracie, like that right side, she wasn't bringing that right rear as far forward as her left rear. And then when we think about a pelvis and how it can move, so when a horse needs to stop, that pelvis needs to move up, right? When they go to extend, that pelvis needs to move down. And when they go to get a leg up underneath them, right, they got to be able to pick that pelvis up and move that leg underneath them. So when we figure eight them, a pelvis that moves normally, and it's not like a crossover, right? We don't want them rolling over like a reining horse. But when you guys do those figure eights, it's like I want you to be able to see how well they're bringing that inside leg up underneath themselves. And if the pelvis is not moving appropriately or the hips restricted, they can't do it. So that leg, they just kind of boom, boom, boom around versus bringing that inside leg way up underneath them. And then I'll have back up the horse because when they back, they should pick up their hind feet, right? They should be able to pick them up. If they drag their toes, that also is telling me they can't get that pelvis up. They're not being able to pick that leg up and move backwards. And so we do that. And then the other thing is that acupuncture scan. And I remember we were going down her acupuncture scan and it's like hitting those points for the stifle hawk, all of that along and that SI. I mean, she was not happy. She
Yeah,
did
she
not
kicked you.
like it. Yes. And she went, yeah, that's right. She fired. I was like, okay, so that's why you gotta be careful where you're standing. And we
Yeah.
would rate that a 4 out of 4. And so we did that. And then I went ahead and adjusted. I remember her pelvis. We did that adjusting. And she kind of was like, whoa, when that adjusted. And then it was like, remember licking her lips. And then we did the
Oh.
acupuncture. And so I love doing both modalities together because when we're adjusting, we're working on the range of motion. And this is one thing that I think people have a misunderstanding of when we think about adjusting or even chiropractic in humans. We're working on the nervous system. And so what happens when things are restricted, our muscles have two processes. They have something that tells the muscle to constrict or contract, right? And something to tell it to release. And so what happens when there's a restriction, those muscles around the joint are contracted. And so they're contracted and now that joint can't move normally. And so when you adjust, it's a high velocity, low amplitude adjustment. And so this is the other thing I just want people to be aware of if somebody's adjusting their horse. The horse should get more relaxed, not uptight. It's not a painful thing for these horses. And because when you're doing that, you're actually releasing endorphins and horses should calm. So
Mhm.
you're not realigning bones. If there's bones that need aligned, you need an orthopedic surgeon. It's literally working on the nervous system with this, low amplitude, high velocity. It's basically if you hold your hands together like in prayer and sneeze, that's kind of the pressure that's needed. And so you go ahead and do that, work on the nervous system with the adjusting, get those muscles to relax. And then when you follow up with acupuncture, we follow up with acupuncture. It works not only the acupuncture on those points that work on specific areas of the body, even internally, but it also works on the fascia because those acupuncture points are in those places where you can work on the fascia to get it to relax. Also works on their nervous system. It works on releasing endorphins and things like that to make them feel better to help with the pain. And also, depending on where you're at, they have other points and uses. So by doing both, we're working on the nervous system, get that joint back in motion, then also working on the fascia and the discomfort with acupuncture to keep those muscles to go whew, right? So it will hopefully hold. And so that's kind of what we worked on. And we did that. And I remember Gracie took her out and she was just like, oh my God, thank God. Like
I can move my legs.
my hips moving now. I can get my leg up
Yeah.
underneath me and I'm ready to roll. So it can be unbelievably I got to get better at before and after videos because I've had those horses like that where you're like, oh, I don't know about this, and then you adjust them and it's like a different horse. Like it's
Yeah.
amazing the impact that it can have with one session. And I remember
Mhm.
we pre-scanned her and she was like, whatever, I'm not gonna,
Yeah.
I don't care now. You
She
can
had
scan
no
that. Come on.
problem.
Yeah, I'm not gonna
So
kick you.
was that oh, sorry. Was that just the giving her you mentioned that in their pelvis, there's a bunch of nerves that run underneath there, and if it's stuck, they get irritated. Was that just taking some relief or some
Yep.
pressure off of the nerves?
Yep, yep, you're getting that joint moving now, so now that muscle's not sitting there in that contracted state, and
Mhm.
now that releases, and now those muscles can move, the joint can move, and everything just kinda goes, whew. Because
Okay.
all of the nerves for the hind limb come out, basically in the lumbars to your SI and pelvic joint,
Mhm.
so in the lumbosacral area. So, yeah,
Yeah.
and when they have that restriction, especially, in the neck and things, those nerves are getting, they're tight and you can get some inflammatory modulators and things there, and so it can cause
Yeah.
some challenges, and that's why not so much in the hind well, you can see it in the hind end too, because I have a horse of my father's actually that had, restriction, lost all the hindquarter muscling, and so we worked and it all came back. But like on necks especially, like if you go by and really start looking at horses' necks just tied to the horse trailer, you can see all the problems in a horse's neck. Just because all the nerves for those muscles are local, and when they have a restriction, that those nerves are not firing appropriately, so they lose that muscle mass in their neck. So you can see that, and you can see tension lines. So even just looking at a horse standing there, you can see how restrictions are affecting them, and with how their muscling is. So,
Mhm. So that brings up a good point that I was just wondering about. What about horses that pull back? Do you see any consistency with horses that pull back in certain tension lines?
yeah, a lot of pole issues, right? So they'll have that pressure on their pole, and a lot of times you can feel that. You can go up and just see that tension. You can feel the tension in those muscles that go up to their pole, and so
Mhm.
that can cause a lot of challenges. And I've seen a lot of horses, and like I say, some of my colleagues might not agree with me, but that's okay. But I've seen horses that are super spooky, and if you adjust that pole, that that is better. And I think part of it is because of how they're carrying their head, right? I don't know the reason behind it, but I do know like horses, some of those horses that are super spooky, that have a lot of issues there around some of those things, you adjust that pole and it'll actually help them. And I don't know if it's, but I think about it too. Like think about having that tension right in your neck. Like, you're going to have a headache, and how you're carrying your head and neck. But yeah, you see a lot of pole issues there. The other thing that you can see on a horse's neck, there's two curves when we think about two curves in a horse's neck. So there's the one that we all think about with the pole, and then there's the lower curve where the cervical vertebrae goes behind the scapula and then ties into the thorax. There's a curve there, and so some horses that have a hard time like collecting and rounding up, sometimes it can be due to lower cervical issues, because in order for a horse to actually round up and collect, they have to be able to lift that lower cervical curve. And if things aren't moving appropriately, or they have that restriction and that musculature isn't there where they can't do it, those horses will be those ones that just stay hollow. And so that's something to think about too, is that. And then the other thing, when we think about with a horse also collecting, another very important thing, we always think about the pole. Yeah, that's important. But the other important thing is the TMJ joint, which people sometimes don't think about. And here's a little trivia fact: it's the only other joint in the horse's body that has a meniscus. So we have the stifle that has a meniscus, and so does the
Mhm.
TMJ. And so that meniscus can get moved around where that TMJ is not moving. But think about when we ask a horse to collect up, we pick him up, that bottom jaw is going to be able to slide, right? It's going to be able to slide so that horse can pick up that upper curve. And then they have to be able to have those restriction free in that lower cervical curve so they can actually collect up and round up and maintain that correct posture. So,
Mhm.
I've seen a lot of horses where that's, maybe they're having a struggle getting that horse to collect up, and you go ahead and adjust it, and they have some TMJ and maybe their hyoid and some neck things, and then all of a sudden that horse is able to collect. So that's one thing, I just think people should think about. If your horse was performing and doing, they were collecting and all of a sudden they're not, you know, don't go, put a tie down or a martingale or put some other headgear on them. Get them checked out first. There's a reason that horse has made that switch. And so that's the other thing that I really tell people too. If you have a horse that's been performing and all of a sudden they're not, that horse is trying to tell you something. So
Mhm.
let's make sure we eliminate causes of that before, you go to some other training methods. Cause I mean, let's face it, some horses maybe need some training. They forgot and they need to go back. And I'm not saying that's not the case either. There are some of that, but sometimes, especially in those horses that are seasoned, if all of a sudden they're doing something like all of a sudden now, wow, they're not collecting, or they're when I go to ask them, they're wanting to stick that nose out. There's probably a reason that horse is doing that. That's caught, so let's get that looked at and fixed before we, go to the training side of things.
Mhm. Yeah, and I'd imagine that's where a lot of behavior issues come from is if you don't
Right.
listen to get it fixed and you just are continually trying a new headgear or a bigger bit or something like
Yep.
that without
Yep.
addressing the pain. That's where horses can get anxious.
Yep.
So both of us barrel race, and I kind of want to transition to talking about barrel racing and the performance horse and how we can keep barrel horses sound. So I know this is like a huge topic and it's we're not going to get through all of it, but you have given me some ideas about just like doing some ground poles, that kind of thing. And can you talk a little bit about that? How can we keep our older horses fit and sound and usable and keep their joints healthy?
Absolutely. So I think there's kind of a three-tiered approach. One is, which we'll come to in a little bit, is making sure, like, I think adjusting, making sure things are moving well and doing those pieces. But things you can do at home fall into two big buckets, I think. One is how fit they are, which we'll get into some things you can do there. And then two is feet. I really, one of the best things, and I know we've heard this a lot and it's becoming more to the forefront, every year, I think in equine world, but is the farrier work.
Hmm.
Horses' feet need to be balanced. And it really does go back to that whole part of no foot, no horse. And because there's been horses that I've been asked to go adjust or work on. And the first thing sometimes I'll do is pick up their feet. Like when I was at the track one time, I looked at this horse. I'm like, I can adjust them, but it's not going to help you until you get this horse's feet fixed because they're loading so imbalanced. So
Yeah.
I think that's one thing. Don't skimp on your farrier. Make sure your farrier is a good farrier, shoeing the horse appropriately for that horse's conformation. And I do think it's good every year to do x-rays on your horse's feet every year for balance, to look at angles and so you know where they're at. So I think that's one thing that is easier said than done sometimes, because even the best farriers have bad days. But that's one. The other
Mhm.
thing, as far as conditioning, I think there's a couple things. I think there's a lot of different, I guess, opinions on conditioning. But when we think about our barrel horses, they are a little different than a racehorse. Racehorses, they need that speed, that straight speed. We're not asking them to turn. But a barrel horses, right? We think about third barrel home. That's a lot of run. So I think making sure your horse does have air, making sure you are do those breezes is important. But the bike thing with barrel horses, right? We are asking them to go from full speed, then all of a sudden collect up, get in the ground, and get around a barrel, right? And where do we see a lot of problems in our barrel horses? People always talk about their SIs, their hawks, right? Those are the probably the biggest areas. Stifles somewhat too. And one thing that we don't do as well on the Western side as I think they do on the English side is they really condition those horses. And when we think about us, especially with your background and your profession, what do people also complain about? Lower back issues, right? Lower back and SI issues. And what are the things we have them do, right? You got to strengthen your core. If your core is strong, your back's going to be better. Well, it's no different for our equine athletes. If they have a good, strong core, that's going to help protect their SI and lumbar area and their LS area. But we can't make a horse do a crunch. But what we can do is those ground poles. And by doing ground poles, you are engaging that hind quarter, and they're engaging their abdominal muscles in order to strengthen that core. And if you ever, and I'm not saying our barrel horses have to look like dressage horses, but if you look at dressage horses, they are so thick through the flank, right? Because it's all that core strength.
Mhm.
And so by doing those ground poles, you're basically making those horses do crunches. And I it's quite interesting the first time you do those, and they don't even have to be that high, just a few inches off the ground, and you don't have to go over them at a lope. It's like the walk and trot and do that. A lot of times these horses that we think are fit, because I've done this with my own, you think they're fit and you go to ask them go over those ground poles and they're hitting them, right? And they shouldn't be hitting them. So
Yeah.
so that's one thing that I think is really good. I think doing the hills, going up and down hills as well is good because you're strengthening that top line, keeping those top line muscles that go down and all the way hooked down into our hocks really in good shape. And by doing those things and then making sure they have the air, because they do need the air, those help as well. So those are just some little things they can do. There are stretches that I think are really important too if done appropriately. When you think about their necks and their backs, especially their SI, there's a stretch you can do to stretch, kind of warm up that SI area by making them extend and flex that SI. That's always a good thing to do a couple, 3 times before you get on them. It kind of warms up that area. Same thing with neck, those carrot stretches, as long as they're done right. A carrot stretch, the horse's ears should stay level. They should be able to stay level and come all the way to their cinch. And so if you go to do that with your horse and their nose is coming out, that tells you there's something going on in their neck. But I see pictures with carrot stretches where people have the treat too high and the horse is following it with their nose. Don't do that. Make sure you have it low so they keep that head and ears straight. And you can do that both sides. That's another thing to do to warm up. And then the other thing to think about, when we think about stretching is don't do your stretching before you run. That's something we do after. And you might remember this, but I like when I was a kid, I think, well, maybe it was the 90s. Remember when it was, they were like, make sure you stretch before you go. And then
Oh
people were
my
doing all the
gosh.
stretches and then having all kinds of injuries, right?
Yes, because it inhibits your muscle. Yeah,
Yes,
exactly.
correct. So that's one thing. Don't do that. That's another thing you
Mhm.
have to do. 'Cause when I see people do that before they run, it makes me cringe because it's like, oh my goodness, you're changing
Same.
the whole dynamic there. Don't do that.
Yes.
And then the other thing I think that we got to keep in mind that we don't do as good in some disciplines as others, and this is one thing they really do well on the racehorse side. You think about the amount of muscle a horse has, and when we ask them to go and that heat, there's so much heat in those muscles after we actually ask them to go perform to make sure we cool them out. Don't take him when he's panting and hot and sweaty and time to the trailer and leave him there, right? Cool him out. So that's another thing to help keep those horses healthy and sound. Make sure you cool them out, walk them. That's why
Mhm.
there's hot walkers, right? But
Yep.
do those things, cool those muscles out so they're not getting that tightness and problems like, because it's no different than us. You go climb a lot or run and then you go sit on the couch. How do you feel when you go to get up, right? Not very good.
Yeah.
So
How
those are
long do you recommend that people cool their horses out after a run?
So I think the main thing with those is you want to cool them out until you go to touch them and they're not hot, right? They don't have to be, you know what I mean? You can feel that. It's just getting those muscles cool. Because if you start to feel, especially on their chest and up on their rump,
Mhm.
those are big muscle masses. So when you go and feel and it's cooler, and I get it, it's hard when it's 100 degrees, but it's, you know what I mean? It's one of those where it's like, okay, that's what you think would be appropriate for the ambient temperature, but just
Mhm.
until they're kind of cool and that air, they've caught their air, so.
Yeah.
And a super fit horse doesn't take long to cool out. And that's the other thing to have people keep in mind. Like if your horse is taking a long time to cool out, either they're not fit or there's something else going on. So,
Mhm. Yeah, I love that you bring that up because I think that's pretty common. We spend a lot of time warming our horses up, but
yep,
we don't spend as much time on the cool down and really flushing out all of those metabolic waste products that occurred during the run.
yep. Because
So,
barrel horses they will go anaerobic. Even though when you think quarter horses, the difference between quarter horses and thoroughbreds is the length that they're able to go aerobic versus anaerobic on their muscles. But even in a barrel run, a small one, they're still going to hit some anaerobic
oh,
muscles. They're going to have
absolutely.
to come in. And so, yeah, it's so important to cool those out.
Mhm. Yes, absolutely. And I know I've asked you about this before, but what about warm up time? So, in humans and human performance, there's this recommendation that your warm up ends no later than 15 minutes before your competition. So, if you're a track athlete, then you want to warm up and then still be warm at least 15 minutes before you run. If you don't, then the benefits of that warm up, the increased muscle blood flow, the increased oxygen, blood flow, all that, it's not there. What is that? what does that look like in horses? How long? I know some horses take less time to warm up. Gracie took quite a bit more time than the younger horse that I had as a backup horse, just because of her age. And that's how I liked her to feel. I liked her to feel really warm before I ran her. But what is your recommendation?
Yeah, there is that as well. No, it's true. Like one of the worst things you can do for a horse, same thing. Go warm them up, get them nice and warm, maybe a little light sweat on them, and then leave them at the trailer and come back in half an hour. You've nixed all that. So it's
Yeah,
kind of the same thing. I think it's always good to do what you're going to do. If you're going to lope them and get them nice and warm, then, before that run, bring them down, just walk them for that,
just walk.
10,
Okay.
15 minutes and then go and and I know it varies because some of us have horses that are super hot that if you do that, they need a lot more lope down time from the behavioral, the focus side. So you
Yeah.
have to take those things in consideration. But I think the biggest thing is just don't get them all warm and then just go let them stand somewhere. That
Yeah.
that is the big thing because you are going to lose that benefit. And if anything, you already started that cool down process if you do that. And now all of a sudden you're going to put them back in a situation where they got to use those muscles. And I think you can get into some issues there with that.
Yeah.
So
Yeah, just like with
it's
humans
like
and
with humans.
things.
Yep. Yep.
Yeah. Okay, so speaking of keeping horses sound and fit as they get older, let's talk conformation from a vet's perspective. So this is something that I'm like so fascinated with. And you brought up a horse that is very, very well known that actually doesn't have that great of conformation. And I just was like, well, I want to know what good conformation looks like in a barrel horse. So what do you look for in a barrel horse to make it successful, lasting, as not just successful in the arena, but that they're sound for a long period of time? Because I think that's what everybody is looking for.
Right. And I think the big challenge, which is unfortunate, what's happening to our running quarter horse breed is we're breeding the bone out of them. Right. So I think one of the big things we got to look at is bone and foot. Like there's that proportion. So the last thing when I think about a horse, if you got a 16-hand horse and he wears a double-aught shoe, eh, that's not good. So I think looking sometimes proportionally, does the bone match the frame of the horse is a big one, right? When we think about our barrel racing horses, what are we at? We're asking them to be able to collect up, get down, get underneath themselves, right? And not, even on a horse that does it correctly, is taught to do it correctly, as well as has good conformation, they're still going to be wear and tear. So think about those horses that are super long in the back. They're going to struggle, right? They're going to struggle. Or a horse that's super upright behind, like almost post-legged behind.
Yeah.
They're going to have a heck of a heart. It doesn't mean they can't do it. It doesn't mean that there aren't horses out there competing at the highest level with that conformation, because sometimes heart and grit can overrule sometimes conformation. You can have the perfect conformation and no heart, and he'll get outrun by a horse that maybe doesn't, but has the heart.
Mhm.
But in general, you think about, you want that shorter top line and longer underline. Those are those horses that can really reach, but also get up underneath themselves, making sure they have a good slope to their shoulder and they're also with their hocks in the back. Cause if you have a horse that's too upright, think of the wear and tear that's going to have, whether it be on the front end or the hind end. Um,
Mhm.
but especially on the hind end, if you have a really post-legged horse behind, they're going to struggle getting up underneath themselves, right?
Mhm.
Like I say, once again, it doesn't mean there aren't some that can do it, but if you're looking for those prospects, like that's something that I wouldn't like too much. And pigeon-toed horses, I mean, they're going to bench need. Those horses are going to have challenges on the front end because just the concussion, and it also depends on what you're doing with the horse. If you're going to futurity a colt at 3, ooh, they better have some pretty good conformation, because if they have things that aren't, they're still growing. So you're going to have more wear and tear. If you have a horse that maybe doesn't have perfect conformation, but you're not really going to start running him hard till he's older, you probably can get away with some more things. But I think no matter what, with that conformation, this really does go back to the feet, making sure that that horse is shod appropriately, has the right angles, right? We're not having horses land wrong, because it blows my mind how many horses I'll pick up those front feet and their heels aren't even. So, they're landing harder on one side versus the other because of how that horse is shot. And you have those concussions now going all the way up the leg, right? Or
Mhm.
making sure, when you think about hinds, most horses, if a horse, when you look at the AQHA, that sorrel horse we think of that they have with all their thing, like that horse is supposedly the perfect conformation. But when you look at him, it's like, not really. Because a horse on the hind end, they are going to toe out just a titch, most of them, and that's okay. but you see a
Mhm.
horse that's really cow-hocked, he's gonna interfere, right, with how he moves.
Mhm.
But it's
Yeah.
also, if you have a horse that gets a little flare and your shoer isn't taking that off him, next thing you know, you're gonna accentuate that, right? So, that is a big, like, I just see that so much is just how, chronically wrong shoeing can cause so many problems because of the physics of it. And that goes back to that, 10,000 not so good steps. So, I think that's the big piece. Or seeing horses, okay, yeah, they are a little pigeon toed. Okay, you got to work with that. You can't, if you try to make that horse straight, you're going to create problems too, right? So you have to shoot at that conformation.
Mhm.
Um, but I think when you're thinking about conformation for barrel horses, I do like those little short back, long underline, got that good slope, a good slope to their hocks, not post-legged and good and straight in the front end, with a proportional frame, right?
Mhm.
So those would be things to think about.
Okay. So you have a couple of studs. Tell us about Just Make a Mark and Dream Big, Win Big. Dream Big, Win Big.
I love it.
Yeah, we are so lucky that we have you and your dad and your racehorse program here in southwestern Montana. I mean, we don't have that kind of opportunity a lot of times in Montana just because of where we live. Montana is so rural. But when I saw Jess make a Mark's poster on the Purina countertop, I just was so excited. And I remember, I don't know if I texted you or what, but I'm like, is this yours? Like, this is a really cool bred stud. And so tell us about him, tell us about Dream, and yeah, I just want to hear about their conformation and what they're like.
Okay, well, this is fun. So just make a mark. We'll go talk about his mother and granddam. So we'll start with the granddam. The
Okay.
granddam was a mare named Girling. She was by First Down Dash. She's buried on her place, but my folks purchased her out of the Heritage Place sale, God, a lot of years ago. And like I say, by First Down Dash, and her second dam is Girl Secrets, who was a world champion. And Girling produced a lot of stakes horses for us and was just a great producing mare. And then her daughter, Girl Just Say It, or Girls Don't Say, that's right, gosh, sorry, that was one of the other ones. Girls Don't Say is by Tracy. We bred Girling to Tracy and had Girls Don't Say, and she was a runner, that mare. I mean, she's a stakes horse and a running machine. And there is a horse at this point, and we'll go back, Apolitical Jess. So we decided, Dad always had the foresight for these studs coming out of racing. Like, he always could pick the ones, like, yeah, they ran well, he knows, looking at the pedigree and how the horse is made, like, they're gonna be something. And
Mhm.
so Dad booked a contract with Apolitical Jess when he came out of race training. And Girls Don't Say, we bred her, and unfortunately she aborted that year. And so we lost the colt but bred her back, and we got Just Make a Mark. And he is he was a stakes horse for us. He was a grade 3 stakes horse, won multiple races, ran in the 90s, and outran some big time runners. And the fun part about that is that Apolitical Jess Tracy cross in the running world is huge, because Apolitical Jess surpassed, I think he's the most producing sire of all time. He's surpassed First Down Dash and all those. His colts have run out over 72 million. And so, and the funny part is Mark looks exactly like Apolitical Jess. They are the same. It is so funny. They are the identical breed. They're not like Mark's, like, well, I think we measured him. Is he 15'1", short little back, like, just, and they are runners. And then of course with the Tracy side, right? We know how Tracy not only was a big runner on the track. My mother always loved Tracy. So that's where that came from. And, but
Uh-huh.
also burning it up in the barrel pen.
Oh
And
my gosh, yeah.
Mark has the best little, he's a big goober. He's got the best personality. I just love him. I'm gonna try to start him on the barrels this year, so it's fun.
Oh, cool.
Yeah, he just is, he's just a really cool boy, and an athlete. Like, he is so
Mhm.
fast and just a lot of fun. And his first crop of colts hit the ground this year. Super excited. I'm going to be a nervous wreck. I bred one of my little barrel. She was a winner on the track and a barrel money earner to him. So I'm going to be a nervous wreck when she foals, but super excited about that. So, and like if anybody ever wants to come see him, it'd be great. He's a cool horse, and he's gonna do. I know he's gonna produce well because, like I say, we had the whole bottom line of his family. They all,
Mm.
they all produced and were all really good horses. So, and then Dad's venture on the other horse, Dream Big, Win Big, and Dad and Josh Abbott, they're partners in this big thoroughbred. A friend of ours who ski jors, and uses a lot of our race horses for ski joring, so it's a lot of fun. But he is a big thoroughbred horse. You'd never know he's a thoroughbred. He's just shy. What is he? 16'3" is what he is. Short back, good bone, bay. And what Dad and them have done, they're working with Warren Johnson, who a lot of people know out of Jardine, who has a lot of half draft mares. So they're bred him to a lot of half draft mares to just be ranch horses. He has got
Okay.
the best mind Dream. He didn't run because he had an injury. He has a lot of run in his pedigree, and his dam produced on the track, but we're using him for that. And so he has one foal on the ground from last year. We bred one mare, one of Josh's mares, and he's quite classy. So they're excited about that for kind of good mountain and using horses. So that's the story with the boys. They're both big goobers, and yeah, super nice studs. So
Okay. Oh my gosh, I'm so excited. Yeah, and we've talked about that. I'm really excited to breed Gracie to just make a mark. And hearing you talk about his maternal line being in your family for so long and producing really great horses, and then being apolitical Jess, I'm so excited for that. That's something that I'm passionate about, and I hope that this is the foundation of my barrel races for the future is to keep Gracie's line really, really strong in the maternal side of it.
oh, absolutely. They will cross so well. And the fun part, we're gonna is he gets colts of age, we'll get him in all the barrel incentives too. Like that's our plan
Mhm.
because I know his mind is so good. Like it's just, he that's what's so awesome about it. Not only does he have the run and athleticism, but he has a good mind. But then again, so did all of the colts out of those two mares, right? So it's
Mhm.
just that's what's fun about it, I guess. And that's why my folks, we kind of look at him and it's kind of exciting because it's like years of breeding on their end too, right? Light and to have him there, and we're just so excited to see what his colts do. So, and I know him and Gracie will cross unbelievably, and it's going to be so much fun to see that
I
baby.
know. Oh, I'm so excited. That's like all my dreams for her now are just like in her babies, and I'm like you, I'm a nervous wreck. I actually for her first baby, I I think I was fired by everybody in my family for just being crazy because I had a halter monitor on her and it went off every single time she laid down over, it was either 30 seconds or 60 seconds. So it'd be like 3 in the morning and the halter monitor would go off and I would just out of, just sleep in my eyes, just run out there or whatever. And she'd
Oh,
just be taking a rest and she'd, come see me. And then when she finally did have her baby, everything went so perfect. Like it was very, very short and easy and perfect. I'm like, I really stressed out for months over this. And she was so good at it. She had no problems, it wasn't anything stressful. And my friend Paige always told me that. She's like, you're just gonna wake up one day and there's gonna be a baby there. Like she's gonna
yep,
be fine. You just have to stop
yep.
worrying about it. So
That's what Dad tells me. I'm like, I know. He's like, how many babies have you been around and delivered? How many mares and foals have we had? I'm like, I know, but it's different. This is different. This is Brimmies and Marks.
yeah, I know. It is. I really get that. If you don't mind, what are some things that you do for mare care preventatively or just mare care in general when you do have a high stakes baby like that you care so much about?
Well, there's a few things. I think one is nutrition, making sure they have really good nutrition. And this isn't to say that to endorse a product, but we use platinum. I love
Mhm.
platinum mineral. I mean, it's just a great, they're a great product, making sure that
Yeah.
they're there, but also balancing. We don't want our mares too heavy either. Like they need to be in good shape. You don't want to let them get obese. That's a big one there. We always make sure with those mares and babies, we foal them inside. We have monitors. So when they get closer, getting them into a stall ahead of time, making sure they get comfortable, right? So they're relaxed and in that place as well.
Mhm.
Making sure with the baby or the mare, we always do a SAA. You can do that coming up a few weeks or a couple weeks before they foal, making sure there's no signs of like placentitis. There's some things you can check in the mare before they get ready to foal, making sure they're good there. Once they foal, it is true. You let the mare do her thing unless you have to, because sometimes, you don't want to interfere too much. But then it's making sure too that we use the full bucket full starter, which is a probiotic that we give them to make sure that they're getting that in hand.
Okay.
We, God, 15, 20 years ago, had some problem with Clostridial. So we do metronidazole in those colts, just to make sure we don't have any Clostridial issues, making sure keep their navel in good shape is a big thing there. And then once
Mhm.
the mare passes the placenta, making sure they get Banamine, you also want to deworm them within that first little bit as well, because that'll help decrease some of the strongyloides that can go to the baby. So those are some things there, and making sure they just stay happy and healthy and they get up and nurse, and checking an IgG. A lot of people don't do it, but checking that IgG to make sure those babies get that passive transfer is huge. And you have up to 24 hours for that baby to actually absorb that colostrum in their gut. We usually try to check the IgG about, I don't know, around 18 hours, because if they don't get it, sometimes you can give them oral versus having to give them plasma. But it's such a cheap insurance, because what happens is, and this is the sad part, if they don't get passive transfer, it's pretty easy fix. You can give them, plasma if you need to, IV plasma, and the baby's going to be fine. If you don't, then those are those colts that break with diarrhea at 3 to 5 days of age, and now you could have if you send them to a referral center, have three to $5,000 in them, and still end up with a dead colt because they didn't get that passive transfer. So I just think those are just such simple insurance. And it's easy. If they don't, you can handle it and the baby will be fine. But if you don't, you can get in a big wreck. And, in all reality, it is true. I'm thinking of all the years. God, my folks been raising babies for as long as I can remember, 30 plus years. And I think we've had one or two in that time period. And usually we foal anywhere from 4 to 12 mares a year. And like we've had one or two that haven't had passive transfer. So it's not
Mhm.
that it happens that often, but when it does, it's a huge consequence. And so it's just easy, cheap insurance. So those are
Okay.
the things.
So there was one thing that you mentioned that I haven't heard of before. So you give the mare Banamine after she passes the placenta. Is that in the vein? And why do you do that?
Because mares are crampy, right? Like they're
Okay.
crampy. But if you give it before they pass the placenta, then
They
it
won't
stops, and
pass.
then you're gonna
Got
end up with a retained placenta, so that's bad. And you can do an oral. You could do an oral
it.
too, but and
Okay.
some mares don't need it. But it's just something that we do just because those mares, sometimes they'll be crampy, and it depends like on their pain tolerance. Like humans, they're all individual, because some mares will be up and down a lot just because that uterus is cramping.
Yeah.
Afterwards. But that's the other thing to really make sure is check that placenta, make sure they passed all of it. Because you can see the horns, and the babies always are in one horn, one will be big, and then you'll find the other little one, but making sure all that has passed, that's always
Okay.
a good thing to check as well. And then your mare's okay. So
Okay. Okay. Oh my gosh, that is so helpful. I'm really glad that we talked about that, and I'm sure I'll have so many other questions for you this spring. But I'm glad that we're able to touch on some different tips that people might not know and be doing. Okay. Do you have any questions that you would like me to ask you that didn't come up, or anything that you just want to say as being a performance vet?
yeah, I think, the big thing for me, like especially when I started to do all of this, is just the importance of, I really do think, the adjusting, that medical manipulation by keeping those joints moving. And I can give you, um, this is, it is anecdotal, but it's not. So my father, when he was at Prairie Meadows there, one season I was going every 2 to 3 weeks to Iowa. I'd work on his and work on a bunch of clients' horses. And we followed those horses for the race meet. And what I'm going to say is, not only my father's, but the horses that I worked on routinely, they did not need injecting. Like, it was pretty amazing the difference on those horses, on
Mhm.
the maintenance that they did not need. That was quote unquote, we call maintenance. Like, we love to say, oh, we need to inject them on a maintenance schedule. And I'm not saying that some horses don't need it. There are cases. I'm not saying that at all. But it was pretty amazing to follow this cohort of horses by doing that adjusting every 2 to 3 weeks, and doing acupuncture when we needed to, and just
Mhm.
following those horses' gait. Because I have some boots you can put on a horse too that can measure how evenly they're landing. By tracking those things, we were seeing less issues with those horses during that race meet. And so I thought that was pretty cool that you're able to pick up subtle things and just, address them, and not having as much need for dealing with things, that might be coming up as a problem. So I think it's huge that we do those things for these athletes, keep them moving well, knowing that it might be, it can be quick, right? Like that's the funny part. It might just be one or two little tweaks you have to make. But it
Mhm.
was quite impressive to see that difference in those horses by following them. And that's something I'm probably going to do with my thesis is kind of look for a cohort of horses to follow. And by doing these things, so we'll do it in a more scientific, this is like say anecdotal just from the few horse, my folkses and then a few other barns. But I'm going to try to do a more kind of rigorous scientific study for my thesis following some of those horses this summer. So
Mhm.
kind of my plan. But
Well, and I think that that's just right in line with what I see in humans. So if you have a painful knee, it's going to be the other knee or the other hip that goes out next because you're going to be compensating. Or if same thing with a hip. If you have a painful hip, it's going to be the opposite side knee. And it's all these compensation things where if you address it first, then you're
yep,
not going to compensate and then you're not going to end up with the low back pain or whatever. And so I I think that there's probably enough human research that you could, on that, on
great.
the if you address something, then you don't get the contralateral compensatory limp or whatever.
Yep.
That you could make a really cool study with that. So I'm so excited, and I think that will be really life changing for a lot of these young horses that are starting and competing at such a high level so young. The futurity thing is huge right now. And maybe that's the same as race horses. I know they race horses young. So if we can, just like your race horses, if we can start working on these futurity horses young and keep them healthy and sound, maybe they're not going to need hock injections at 4 or 5 or 6.
Yep.
Yeah.
Yep, exactly. And and that's the thing. It's like with the injection thing, it's super controversial, right? But whether you just got to go to a Facebook page, right, with about barrel racing and see the controversy around things. And it's injection steroids definitely have their place, and I'm not saying they don't, but I also think the other thing I guess I want to put out there, and I don't do this, but if you have a horse that needs an injection, there are other options. There's biologics today. You don't necessarily have to put a steroid in a joint, right?
Mhm.
Whether it's Prostride, PRP, there's a bunch of different ones out there. Artemidas, I think, is the other one that actually the biologics can actually help heal the joint when it needs something, but it's not as instantaneous as a steroid. So that's why a lot of times people will not do that right away. They will, say, I need to go now, so I'm going to stick steroid in my joint and go, whereas some of these other biologics take a little longer, but they're actually, when you look at some of the research, the human research in other countries, because we don't do a lot of it here in the United States, it's pretty mind-boggling how, like with athletes, like especially in like it was South Korea, Japan, like if there's an injury, a lot of times they'll do one of these biologics and they versus a steroid, and they're not seeing those wear and tear down the road, right? Because we're addressing it, not just putting a band-aid to decrease the inflammation. And we all know steroids can degrade the joint as well. So
Yeah.
so I think by once again, this goes back to that integrative approach, making sure we're doing, doing the manipulation, make sure they're moving well, make sure we have a good farrier, making sure we're physically fit, have good nutrition. But then also when there is an issue, let's think about what would be the better long term for this horse and looking at some of the biologics and some of those other pieces out there and getting a diagnosis. I think
Mhm.
that's the other thing. Sometimes we get impatient and like, well, if we didn't do well, I'm going to throw some steroids in a joint and go versus, all right, let's figure out why, what we can do to hopefully prevent that. And
Yeah.
I know it's challenging because time is money. And I know there's a lot of money in horses and things, but just, something to challenge people to think about.
Mhm. Absolutely. Okay, so if someone wants to get a hold of you, how can they get a hold of you? What is your clinic is based in Twin Bridges, Montana, but you travel, you're a
Yep.
travel vet. So Twin Bridges, Montana, but how far do you travel and kind of how can people get a hold of you? Also, share your Facebook page as well.
Okay, great. So it's Chi Performance, but it's spelled QI. So usually people know how to pronounce it, but it's Chi Performance is my Facebook page. And you
Okay.
can reach me there or my phone number. You can just give me a call. It's 406-600-1594. And
Okay.
what I do, I travel a lot. And what I try to do is group horses. So, I mean, I've gone as far, like when Miles City is in with the race meet, I'll go to Miles City and work on horses, for a
Okay.
weekend. So it's one of those where if I get a group of horses, I'll kind of come anywhere. So
Okay.
we can make anything work there, and people can come to me or I can go to you. And I love working on them and spending time. And just, my other thing with people is, it's never a one and done. So, it's one of these things we're asking our horses to do a lot of, perform for us. So a lot of times it's not one and done. So just something to keep
Mhm.
in mind too. So,
Okay. All right. Well, Carrie, thank you so much. I think this episode has so many gems in it for everybody, for riders, for barrel racers, for people on the racetrack, people looking to breed. You brought a ton of value. So thank you so much. And I will link to your Facebook page and provide your contact information in the show notes.
well, I appreciate it. Thank you so much. It's always good to see you.
Yes. All right. Thank you so much,
Thanks.
Carrie.